Hello everyone, this is Max from Remarkable Physiotherapy and Rehabilitation, and welcome back to our channel. Today we have a new face in our channel. Her name is Rei.
In today's video, we are going to discuss about gestational diabetes with some of the common conditions and some exercises to improve it.
Gestational Diabetes mellitus, or GDM for short, is a temporary condition and most common health problem during pregnancy when there is too much of sugar level in the blood. However, high glucose level will return to normal reading after delivery. This is usually because of hormonal changes during pregnancy and the inability of the pancreas to produce enough hormone to control the glucose level. This can happen at any stage of pregnancy, but it is most common in the second or third trimester. Pregnant women who have been diagnosed with diabetes has a higher risk of GDM. Although gestational diabetes goes away after delivering the baby, it can affect the baby's health and may increase the risk of getting type 2 diabetes later in life for the pregnant mother. Risk of GDM is higher in individuals who are older than 25 years old, overweight, and obese. Lack of physical activity, has a history of gestational diabetes or prediabetes, family history with diabetes, health conditions linked to problems with insulin, high blood pressure, cholesterol, heart diseases. Delivering a baby that weighs more than 4 kilograms previously may be one of the risks as well. So, what happens if gestational diabetes is left untreated? One of the pregnancy complications during GDM is premature birth or birth before 37 weeks of pregnancy. Labor inducement will be applied before the due date of the pregnancy, which means that the doctor will break the amniotic sac or medications will be provided to begin the process of labor. Shoulder dystocia or other birth injuries. This happens when the baby's shoulders are stuck inside the mother's pelvis during labor and birth. This often happens when the baby is too large in size, and it will cause serious injuries to both mother and baby during labor. Caesarean birth or C-section, in which the baby is delivered through a cut through the belly and uterus. This is because complications during pregnancy causes the baby to be bigger in size, and this will harm both mother and baby during labor. Stillbirth, a situation where the baby is dead in the womb after 20 weeks of pregnancy. Healthy diet comes from all sources of carbohydrates, proteins, dairy products, and fruits. Carbohydrates can be taken from whole grain products, beans, and starchy vegetables. Source of proteins such as meat, fish, dry beans, eggs, and nuts. Dairy products are a great source of protein, calcium, and phosphorus. Low or non-fat milk and/or yogurt without sugar or artificial sweeteners can be included into your diet as well. Try to limit on foods which contain sweets, fats, and oils. Sweets are high in fats and sugar. Even sugar-free products may not be the best as it may not be free of carbohydrates and calories. Healthy oils such as canola oil, olive oil, nuts, avocados, and olives provide energy for growth and essential nutrients for your baby's brain development.
Exercise is one of the ways to reduce the risk of GDM. Aerobic exercises such as walking, swimming, and dancing are usually recommended, with a minimum of 30 minutes to an hour, 3 to 5 days a week. Surprisingly, 2 to 3 days with a day off in between per week of strength exercises includes weights or resistance are recommended as well. Whereas for pregnant mothers which are currently inactive, you may start with a minimum of 10 minutes walk around the block, park, or 20 minutes of swimming for a few times in a week and slowly build up from here. Frontal Race. Stand with shoulder width apart and a light weight in each hand. Your arms should be hanging down in front of your thigh, palm facing toward yourself. Keep your arms straight, then slowly raise the weights out and up in front of you until your arms are parallel to the floor. Then slowly lower the weights back down. You can make it easier without the weights or harder with heavier weights. Repeat these exercises for 10 repetitions, 3 sets. Wall Sumo Squat. Find a wall and lean your back on it with your feet about 1 to 2 steps away from the wall. Stand with your feet about shoulder width apart with your toes pointing 45 degrees outwards. Bend your knees and maintain your back on the wall to lower down into a squat, as low as possible up to a 45 degree to 90 degree angle. Straighten your legs and return to the starting position. You can make the exercise harder by maintaining in the squat positions for 5 seconds and slowly progress up to 10 seconds. Use a chair to support yourself in the front as you squat down for more safety. Repeat this exercise for 10 repetitions, 3 sets. Aerobic exercises can perform up to 3 times a week. Gradually increase the duration for about 15 minutes according to your doctor's prescription. If you are not able to sustain for a long period of exercises in a single session, try to perform the exercises by a minimum of 20 minutes per session and perform it 3 times a day. By having regular physical activity, it can help to reduce the risk of GDM. Exercises with moderate intensity of 30 to 60 minutes per session can help the pregnant mother to prepare for the birth of the baby, improve baby's health and reduce the risk of baby growing too big. Reduce muscle and joint pain such as lower back pain, and most importantly to achieve targeted glucose level. Stop exercising and seek for medical advice if you feel that there is chest pain, shortness of breath, dizziness, back or pelvic pain, sudden swelling of ankles or hand. Worst come to worst, the pregnant mother would feel that there is contraction or bleeding and decrease in the baby's movement. Well, we hope that you find this video helpful, and that's all for today. If you like this video, click on the like button, share it, and subscribe our channel.
Once again, I'm Mac.
And I'm Rei from Remarkable Physiotherapy and Rehabilitation, and we hope to see you in the next video. Bye!